Mitch Stover is an active man in his late 50s. He knew there was a real problem after making a trip to the bathroom. His straight path turned very bumpy. Here's Mitch's story. 59-year-old Mitch Stover was the equipment manager for Penn State University and a husband and father who loves the outdoors. It was a trip to the bathroom, though, that led him along a new path.
Couldn't go to the bathroom, it didn't want to come out. And that was the very start. Something was wrong.
At the age of 56, Mitch's active lifestyle was interrupted.
The problems got worse because I woke up, I went to the bathroom and I woke up and the toilet water was all red.
Mitch was referred to a urologist.
The first thing we did, and technology is great. Gosh, they went up the urethra with the camera and took a view of my bladder.
The doctor saw a mass, and then came the diagnosis.
He said, yeah, you have cancer because it might be a little bit bigger than a golf ball.
Cancer. It's a scary word.
We drove home that day, my wife and I, and we kind of drove in silence when we first heard it was cancer. And, I think I looked over at her and I said, life's changing.
After surgery to remove the cancer, the doctor sent him to urology oncologists at Penn State Health, where he would undergo chemotherapy and meet with Dr. Matthew Kaag, who told Mitch he had muscle-invasive disease.
The middle layer of the bladder is a layer of muscle that allows the bladder to contract when we urinate. And when the disease gets into the muscle layer, it has access to the blood vessels and the lymphatic channels that allow it to spread around the body.
Surgery is how this cancer is treated.
The next step was to go in and take the bladder out. And along with the bladder, when that goes out, the prostate has to go out.
And then we have to reconstruct the urinary tract somehow because the urine still has to get out of the body. We take a much longer section of intestine, we open it up lengthwise so we have a long sheet of tissue to work with, and then we start folding and stitching until we get something that resembles sort of a baseball. It's a round sphere, hollow on the inside, with stitching lines all over it. And then we plug the kidneys into the one end and we sew the other end into the urethra, the tube that the man urinates through.
A new reconstructed bladder that would take several weeks to heal.
He went through it quickly. He was very motivated. He was a very intelligent and insightful patient, which, his ability to sort of grasp the issues and follow the instructions that he was given, I think really helped.
I kind of use a metaphor like, my road was all paved and stuff. And this is when the road started getting potholes in it and then it turned into a dirt road.
But that dirt road became smooth again. After 6 weeks, his new bladder was fully functional.
The road got paved for me. Just it took more time. It takes a lot of work. Now I'm a pretty normal guy.
It was remarkable. 6 months after surgery, Mitch ran a 5K and finished it. He's also back to working and spending time outdoors.